and I'll just ask you if you have any questions, go ahead and shoot. If you want me just to kind of pick through a few questions and then highlight those, then I'll just start doing that if I don't hear from anybody. All right, then I'll go ahead and get started since I'm recording. And then, like I said, if there's a question you have, just drop it into the chat and then just let me know, and then I will work through it. So you should have a good idea of how to do these at this point in time. Being fourth semester students, you should have your conversions down, and you could see that they added in the the centimeters to inches, inches to centimeters, tablespoons to milliliters, pints to ounces. There's even a grams to micrograms, which is going to be a huge number. But these will be good for practice for you. Sometimes students will ask me about rounding, and I always tell students, rounding is based off of what you've rounded previously in previous semesters and what your instructors have instructed you to do. So if you've ever missed a question about like had to do with rounding, you kind of know what those are. But anytime you're staying and you're going metric to metric, so liters to milliliters, grams to micrograms, micrograms to milligrams, you don't round those answers. You leave your answers as they are. Like this one here, number 7, the answer would be 0.125. You wouldn't want to round that to 0.13 because you're just doing a metric to metric conversion. However, when you're going from pounds to kilograms, if you have this enormous decimal points, then you do round to the nearest tenth. And so that's when you're staying within the same units, whether it's household to household or metric to metric, typically you don't need to round. In fact, in these first like 10 questions, you typically are not going to round if it's just a metric to metric conversion. But if you are going from centimeters to inches, inches to centimeters, tablespoons to milliliters, pounds to kilograms, then you would round to the nearest tenth if you need to. A lot of times you don't need to, but typically you do with pounds to kilograms because you're dividing by 2.2, and that doesn't typically end in a whole number. All right. So let's go ahead and look at these IV heparin drip rates. And then, like I said, if you have more that you want to add, then or other questions, let me know. And then if you're wondering where this is in the shared OneDrive folder you should have received a link for. So I'll just go ahead and I'll start reviewing this. I'm working on the edited version, meaning that I will have my writing and I'm going to change the spacing and things like that. There's an unedited version. That's what I would recommend that you open up and look at if you don't already have this. All right, so this number 11 says that the doctor orders patient to start an IV heparin drip at 18 units per kilogram per hour and to administer a loading bolus of 30 units per kilogram before start of the drip. And then you are supplied with a bag that reads 25,000 units to 500 milliliters. And the patient weighs 172 pounds. What is the flow rate? You will set the IV pump at, and how many units will be administered for the IV bolus. Now, we're missing the bolus information in this because there should be a bolus information, meaning we should have a separate bolus dose listed here. But since it's not listed here, we'll just have to use the 25,000 units, 500 milliliters as our bolus dose starting point. Since it's asking for both these things. Oh, I'm sorry. Never mind. We would only really need to know the bolus dose if we were wanting to know how many milliliters of the bolus. So since it's just saying how many units, we can do that because we're just going to multiply our patient's weight in kilograms times 30 units, and we'll get the bolus information. So I'll start with the bolus because that's the one that's probably the most straightforward. And again, if this is not something you want to see, I'm happy to move on to something else. So I'm going to take the patient's weight in pounds and convert it to kilograms. Now, typically, and most places, you're told not to round to the nearest tenth, or not to round until the very end. And I will tell you that it's probably a good strategy, and you might want to wait to do your rounding once you have all your calculations set up. So what I'm saying is, if I were to set this up appropriately, I might want to do something like this: 172 pounds, and then 2.2 per kilogram, and then 30 units per kilogram. And then set this all up and then save your rounding for the end if you're really concerned about that. Now, I will tell you, and I'll even I'll show you what I get when I do this. Your answer is going to be about the same no matter what, because your patient's weight is high. The rounding at the end when there's weight-based calculations typically is going to be more impactful when you have like a child or a pediatric patient, somebody that's like under 80 pounds, because the numbers get lower. But when you have a big number, like 172 pounds to kilograms is 78.2 if I round it to the nearest tenth, or I leave it at 0.1818181818, you're still going to come up with the same answer at the end. And I'll demonstrate that in just a second. So I'm just going to leave it in my calculator as the 78.18181818 times 30. And I'm going to get 2,000 or 2,345.45. So if I'm doing this based off of what I understand from the standpoint of how you guys are supposed to be doing these, as far as rounding is concerned, even though this is a huge number, that should be plenty. But until I'm told otherwise, you're always going to round to the nearest tenth. So it's 2345.4545 repeating. So it'd be 2345.5. And then I just want to double check the answer, the key, just in case that's different. So question 11, they wrote 2346. So my guess is that I don't know who put together the key. You might get 2346 if you round to the nearest tenth. And so that's what I'm gonna try out next. So I'm gonna take the 172 divided by 2.2, and I'm gonna take 78.2 times 30. Okay, and that's where they got the 2346. So you see there can be some discrepancy depending on when you did your rounding. Your most accurate answer is the 2345.5. And my guess is that if you were asked a question like this, that there wouldn't be that, or you could at least argue your point that, well, I waited to do the rounding at the end. The reason I'm telling you this and giving you kind of like a gray area here is because it does depend, because some people have been taught to save rounding to the end. Some people have been taught to convert patients' weight in pounds to kilograms, round that number to the nearest tenth, then continue with your calculations. So depending on how you were taught, that could influence your final answer. And you'll notice that like we're talking about like half of a unit. That's probably not significant for an adult patient as far as this is concerned, for the quantity there. Okay. So it's like, if you have $2,000, but then like you were to lose $1, you still have like, close to $2,000, and it's not that big of a deal, if that makes sense. Putting that into a money standpoint. Anyways, so saying that, like, if you were to do this, like I said, using the 70.2 kilograms times the 30 units per kilogram, that's how you would get the 2346 units. So if you're wondering where that is coming from. So again, that might be something you want to clarify with your instructor, if that's a type of question that you feel like you would want to know. Now for the infusion rate, hopefully this works out. So for the infusion rate, we're going to take the same weight. So again, I'm going to show you both ways just so you have a little bit of extra practice with this. So if I'm doing it this way, my 1 kilogram, 2.2 pounds. And then we have a 18 units per kilogram per hour. So kilograms cancel out, pounds cancel out. And then we want to convert units per hour to milliliters per hour. So that's where your IV comes into play. So 25,000 units, 500 milliliters. And then I'm going to see what it comes out here, and then I'll do it. I'll also do it using the 70.2 kilograms. Times 18 times 500 divided by 25,000. I'm just shorthanding this just so I'm not writing everything else out. Oh yeah, thank you. And that is what I put into my calculator, just so you know. Yeah, it should be 78.2. Sorry about that. Thank you for the correction. Yeah, okay. All right. So for this one, I'm going to take I'm just going to do it like I said, the long way, 172 times 18 times 500 divided by 2.2 divided by 25,000. And you're going to get 28.145. So 28.1 milliliters per hour if I save my rounding to the end. And then I want to see what it is going to be. I always like to do this even like for my own consistency, just to make sure, because if I were the one kind of grading your test, I would basically want to account for both those pieces of information, just so you know, but I'm not the one that grades your test, unfortunately. Yeah, so it comes out the same. Actually, if you are following rounding rules, it actually comes out to, if I follow this way, it's 28.2. So again, 0.1, 0.2 is probably not a significant difference, but you want to show your work and then be able to argue your point if for some reason you were to miss that. So they're obviously taking and doing the 78.2 kilograms for their calculations. So I don't know if you've been told to do it one way or another. I don't know that. I'm just giving you that. At Allegheny campus, I typically recommend doing what gives us to the key answers, rounding to the near, or finding your converting pounds to kilogram first. So not doing the full dimensional analysis. Pounds to kilograms first, and then continuing on with your calculations. I know at North Campus, they typically want them to show their whole dimensional analysis work through, which is why they might actually get the same problem, but have a slightly different answer because of when they do their rounding. All right. Hopefully I didn't confuse you too much. Let's do number 12 as well. And then we'll just do we'll do this by doing the converting pounds to kilograms first, and then using that number just so there's consistency with the key. So 198 pounds. Of course, this is going to be one of those that works out perfectly. Yeah, it's going to be 90 kilograms. So no matter what way you did this, you'd be good because it's a solid number. So we start off with 90 kilograms. It says to calculate the bolus. Oh no, it just says to calculate the flow rate. And it doesn't say anything about calculating a bolus dose, because it just says flow rate. I'm going to calculate the bolus just so it's for extra practice, even though it's not asking for it. And then hopefully, you know, don't give them extra information if they don't ask for it. So 90 times 60, and it would just be 5,400 units. I like it when it's a nice even number. Now, typically your bolus dose is like, at least for heparin, with the standard heparin protocol, it's 1,000 units per milliliter. So then if you were to convert it to milliliters, you would first need that information to be listed. You can't assume that it's 1,000 units per milliliter all the time. and then you would get 5.4 milliliters if you were to do that. If I'm doing what it asks for, the flow rate, I'm going to multiply by the 16 units kilogram hour. And then I'm going to multiply by and you can always set the equal to this. I usually just kind of continue on with this and then do my calculations at the end. There's no one particular way to do this the right way. Obviously up here, it depends on the key. And then I'm just going to use my IV solution and the units and the milliliters associated with that. So 12,500 and 250 ml. So I'm going to take 90 times 16 times 250 divided by 12,500. And I'm going to get 28.8. So my answer for 12 should just be 28.8 ml per hour. And then I just want to double check. Because like I said, this is my first time looking at this. So I always like to make sure that there's consistency and that I didn't miss something. So yeah, the answer key is correct, or at least coincides with what I got. So the only discrepancy was that number 11. And like I said, it would, you probably already have a better understanding of, what you should be doing. So if this key is accurate to the point, like how you should follow your rounding protocols, then everything should be good. All right, so those are the kind of the more challenging types of questions that you're probably already familiar with because you saw them last semester, where you have to either calculate a bolus or calculate a bolus and a infusion rate within the same question. It's still one question, even if I've asked you two things. So I'm just going to skim through here and see if there's a nitro drip question. Here we go. Why don't we work through number 16, or I'll work through number 16 and 17, just so you can kind of see, because I think also you probably saw nitro drip last semester as well. So with this one, basically, they're just asking you to actually set the infusion rate based off of what you can program into the infusion pump. If they don't tell you anything other than to set the flow rate in the infusion pump, your default should be calculate milliliters per hour. And you might be thinking, well, why would I do that? Like it says it's in micrograms per minute. Why wouldn't I just keep it in minutes? From what I understand, the standard for flow rate is milliliters per hour. So that's why you would do that. So I do this maybe a little bit differently than some people, but you can decide how you want to do this. So one of the first things I do is, because it's easiest, I usually just convert the 25 milligrams to micrograms. And I just do that by adding 1,000 or multiplying by 1,000. So 25 milligrams is the same thing as 25,000 micrograms. And the reason we're doing that is because it keeps our units it keeps them consistent. And then also you can't divide when you have different units without accounting for the change. I mean, you can't just do 5 divided by 25. You need to account for that 1,000 of that conversion, either dividing 5 by 1,000 or multiplying 25 by 1,000. You have to do one or the other. All right, so I'm going to rewrite this as 5 micrograms per minute. And then I'm going to convert micrograms per minute to micrograms or milliliters per minute. And I'm going to do so by taking that 25,000 micrograms at 250 ml. Now, if you don't use dimensional analysis, the main reason I do this is just to show you the organization. If I tell you I just do this in my head and I get to the answer and I just plug it into my calculator, I don't feel like that helps you. But if you're like me and you do that and you're getting the right answer 100% of the time, keep doing you. That's what you're supposed to be doing. I mean, you're basically doing the dimensional analysis in your head. But I can't assume everyone's doing dimensional analysis in their head, especially when there's 3 or more steps. Now, If I leave this as it is, I will get milliliters per minute, and you'll get some tiny number that will sometimes be incorrectly labeled on the key. At least that's how it is on the Allegheny campus. It's 240 test. So you have to count and you have to convert minutes to hours. Now, sometimes students will ask me, and I get this asked a lot over the years, is, well, how do I know to multiply by 60 or divide by 60? Again, this shows you, I don't even ask that question. I just put it so I'm trying to cancel out the units before I even put any numbers down. And then that gives me the organization that I need. So I'm going to take 5 times 250 times 60. So 5 times 250 times 60. And then I'm going to divide by 25,000. And I'm going to get a nice simple 3 mil per hour. So I'm just going to double check the key. So that was number 16. Yeah, 3 milliliters per hour. Good. So you're going to do the same thing for 17. You're going to convert milligrams to micrograms. It's probably the simplest thing. Convert minutes to hours, and then you'll get to your answer. So if you're putting this together, and this is what I mean by doing it in my head, I would take 15 times 500 times 60 divided by 25,000. And then I just plug that into the calculator because I'm just following the same flow that I made up here. And if you ever get a decimal answer for a flow rate, that probably means you forgot to multiply by 60. So just double check your work before you submit that as your final answer. I'll assume you guys are all good on the fluid intake calculations. The important thing is just knowing what's liquid and what's solid. So orange juice is liquid, coffee's liquid. You might say, well, what about this creamy tomato soup? When I look at that, that looks like liquid to me, because if you've ever made tomato soup, it's usually tomato puree, which is pretty much like tomato juice, like water. It's water, and then you add milk to it. So it's 2 liquids. Jello is a liquid, and then pudding, it would be considered not a liquid. It's more of a solid. And you might be thinking, well, it seems kind of like flowy. It is, but it's just because you thinned out the powder with a little bit of milk. So, and then ice, remember, you give half of that. So all right. Absolutely, yeah. So someone's asking about, can we do a refresher on drop factor? So let's see if I can find one of these. Here we go. All right. So as a reminder, when it comes to drop factor, you need to know 2 pieces of information. You need to know flow rate, and you need to know the drop factor. Those 2 pieces of information give you your drop rate. Flow rate is typically milliliters per hour, but it could also be milliliters per minute. It just depends on what you have, okay? The technical term for flow rate, what you would program into an infusion pump, is milliliters per hour. And the reason I tell you the ml per minute is because if you have it in ml per minute, leave it as is. Like this question says 150 milliliters, 30 minutes. Don't convert that to milliliters per hour, just not yet. 5. Now they're going to tell you, they're not going to necessarily tell you the units. You should already know that the units for drop factor are drops per milliliter. If you do a Google search for, or, just a web search for, drop factor or drop tubing, like drop factors, you'll see pictures of the tubing and it'll say like 10 GTT or 10 drops per milliliter. It'll say 20, it'll say 15, it'll say 60 if it's a micro tubing. So you need to know what those units are, even if it's not given to you. And anytime you're calculating a drop rate, you're calculating drops per minute. So if you're calculating a flow rate, milliliters per hour. If you're calculating a drop rate, it's drops per minute. So setting this up, I'm gonna take my volume over time, 150 ml, 30 minutes, times my drop factor, which is 5 drops per milliliter. And then 150 divided by 3 is 50, and 50 times 5 would be 250 drops per minute. I just want to double check my work. 150 times 5 divided by 30. Oh, 25. Oops. I said 3. I meant I read that as 3 and it was 30, so it's 25 drops per minute. I'm not going completely crazy, guys. I thought that 250 sounded like too big of a number. So now you might be wondering, why didn't I count for 75 milligrams or the 6 hours? And that's because you don't need to. 75 milligrams just tells you the vehicle that you're bringing in. It's gentamicin, 75 milligrams. When we're calculating flow rate, we really don't care what the medication is. We just care about the flow in which it's coming down. So the 75 milligrams just tells you what it is. So it's kind of like a label, like this is 75 milligrams and it's in this 150 milliliters. That's what it is. So you don't care about the medication. So it could be any number of milligrams. If you're calculating flow rate, all you need to worry about is volume and time. And when I say that, I mean from a standpoint of dosage calculation. I do not mean that from the standpoint of, patient administration, right? You don't want to be like the order was gentamicin 75 milligrams because they're, they have a bacterial infection that they're being treated for. And then you give them, Coumadin. Like that's not how that works, right? So from a clinical standpoint, that's why that's important. And every 6 hours is just to repeat. So this 150 milliliters over 30 minutes, you're going to do it for 30 minutes. It's done. And then you're going to repeat it every 6 hours. So you don't need to account the 6 hours. Okay. So the 2 pieces of information that are important are, what is the flow rate now? 150 milliliters, 30 minutes. What is the drop factor 5? And then calculate drops per minute. I was just looking to see if there's another one. Doesn't look like it. All right. That was a good question. All right. Any other questions? Yeah, I was looking to see these blood glucose questions, but it's referencing this sliding scale here. Now, I will say this because it says a patient's regular insulin is given at 8 a.m. and NPH is given at 10 a.m. How much regular and NPH will be administered at 8 a.m.? Okay, so I guess that's kind of like a trick question. Since NPH is given at 10 a.m., they wouldn't receive any at 8 a.m. And then they would just receive the range for 222, so they would receive 4 units. I just want to double check and see. That seems like a tricky question. Yes, they just wrote 4 units, but it does ask for both regular and NPH. So you probably say 4 units regular, 0 units NPH, because you're not giving them NPH until 10 a.m. Well, those are the main things that I thought would be worth reviewing, but we have 20 minutes still. So just if you have anything that you want to see or refresher on, like Bria mentioned, just unmute or type it into the chat. If you're good, then you're welcome to hop out. And if you have any questions, even after this, something that you see or catch on, just you can always email me. And then I will answer your questions. I'll go ahead and type in my email in the chat here for your reference. So that way you can get it. And then I also will upload this recording to my YouTube site. I already did the evening 240 review that I did on Tuesday, so it's already up on my YouTube channel if you haven't watched it yet, or if you need it. So, but okay, yeah, and if you're good, so yep, you're welcome, and you have a great day as well. You're welcome. You're welcome, Bria.